Today's episode is brought to you by DAX Copilot from Microsoft. DAX Copilot is your AI assistant for automating clinical documentation and just being more efficient, reducing administrative burden, all that stuff that makes us feel overwhelmed and burnt out. To learn more about how DAX Copilot can help improve healthcare experiences for both you and your patients, stick around after the episode or visit aka.ms/knockknockhi. That's aka.ms/knockknockhi.
Knock, knock, hi.
Knock, knock, hi. Hello, everybody. Welcome to Knock, Knock, I with me, Dr. Glaucomflecken. This is your one-stop shop for all things eyeballs and occasionally some like non-eyeball related stuff. I always bring it around to eyeballs, though. You know I have to. Ophthalmology. All right. You do know how to spell. You know you can't listen to this without knowing how to spell ophthalmology, by the way. Like, you get one free pass, one free episode. You can get through it. You can listen if you don't know how to spell it, but then you got to go and do some homework. I need you all to know how to spell ophthalmology. It's very important to me. OPHTHALMOLOGY. It's easy, folks. Come on. Anyway, I'm just kidding. You don't have to know how to spell ophthalmology. It's nice, though. Makes me feel good when people know how to spell my specialty. Anyway, I hope you're all having a good day. As always, I'm recording this late at night. I just put my kids to bed. It's hard to get my kids to bed these days. My oldest is into drumming now. She's very musical, very artistic. She's a fantastic artist. Have no idea where she got that from because I am not. Kristen is not. She's a very good artist. And she's also into music, and so she plays different instruments. But she recently got into drumming, and she's taken lessons, and she's been begging us for a drum kit. Now, like, I can tolerate a lot of noise. I think Kristen can tolerate less noise than me, and so your classic drum kit was not really an option. So we got one of these electronic drum kits that you put headphones on, and it just makes much less noise than an actual drum kit, and she's loving it, spending all this time on it. So I don't know. I don't know how to help her. Anybody have suggestions on how to like what do you buy like music like you would? Like when I was learning how to play trombone, shout out trombone players. I looked like a trombone player. I got the long arms, and I'm just like a classic trombone person. And that doesn't even mean, that doesn't mean anything. I don't know. But you could buy like music books. Do they have that for drums? I know nothing about the drums. So anyway, I'll keep you guys updated on the drumming that's going on in her house. I don't really know how to help her, but fortunately she's like really good at helping herself and just figures this stuff out. But if you have any tips for me as a drum dad, I'd love to know. Okay, so it's been an exciting beginning to our live show tour. We just got back from Washington, D.C. Just a few days ago. And shout out all you people in Washington, D.C. area who came out to the show. We were at the Howard Theater, the packed house, just a great reception, lots of laughs, some tears as usual with our show. But the reason I want to talk about this, and I promise you this is going to come around to eyeballs in a second, is I just love Washington, D.C. I love visiting. I've been a number of times, and there is so much to do. I made a joke on Twitter about, I mentioned that I was going to Washington, D.C. for this show, and that I know that they have the Exorcist stairs, the famous stairs from the movie The Exorcist. But like, there's really nothing else to do there. Anybody have any suggestions? That was the joke. Because there's so much to do in Washington, D.C. It's overwhelming how many things there are to do. But this was special because this was Kristen and I. This is our first time without kids. So we've done things like we've seen a few of the different museums. We've been separately, the two of us. We've never been together. So you're like, oh, let's do something that if we had kids with us, there's no way we'd be able to do. And so obviously we were like art museums. There's no way. Like the Air and Space Museum, the kids would like that. The Spy Museum, that's a new one I hadn't even heard of, but everybody told me about that. That's one that the kids would like. And so our kids don't have, obviously my oldest, who I'd mentioned is artistic, like she would probably enjoy the art museums, but my youngest, no way. She'd last 30 seconds and then just be complaining. So we're like, let's do some art museums. So we went to the Smithsonian, what's it called? The art museum, the American Museum of Art. That's what it is. American Museum of Art. We went there and we saw the Hall of Portraits. We went there. That was really cool. That's probably my favorite part of our art extravaganza. What was the other one we went to? There's the other big art. That's not the Smithsonian one. It's on the mall there. Okay, the name is escaping me, even though I was just there 3 days ago. I'm tired, you guys. It's been a long day. Don't get mad at me. God, that's the name's going to come to me of that place we went to. But that was also dang. I'm losing my mind here. Okay, I'm gonna Google it right now. Let's see, Washington D.C. Art Museum. This is what you come to a podcast for, right here. National Gallery of Art. God, how did I not remember that? Anyway, so we went to the National Gallery of Art, saw like your classic impressionist and famous. Like we saw a Da Vinci. That was my first time ever seeing a Da Vinci. We saw some Rembrandts and some various other artists. But what I really want to talk about is the portrait gallery. The portrait gallery was so cool, and especially the Hall of Presidents. This is where they have all like the presidential portraits in here. I mean, all the presidents had multiple portraits, but they put all the presidents in this room. And I'm just kind of like a presidential history guy. I can remember back in like fourth grade, I was like reading presidential biographies because I was just a really cool kid. Yeah. I was like reading like a biography of like Warren G. Harding. I don't know. It's just, I went through a phase. I had a phase growing up. I was just like into presidents and learning about the presidents. And so part of me still has that kind of like interest in that part of history. And so I was like super excited. I'm going to go see all the presidential portraits. And what was the first thing I did when I went there? I tried to figure out, I went around to see how many of the presidents in their portraits were wearing glasses. Obviously, like that was what I wanted to know. And so I went around, and do you know, I have a list. I have a list of all the presidents who were depicted wearing glasses or having glasses with them. I had to expand the criteria a little bit. All right, so do you know how many? Can you guess? Think about it right now. Think about your guess. All right, here we go. 5. There are 5 presidents that have some proximity to glasses, okay? Here we go. We don't see, the glasses don't make an appearance until Woodrow Wilson, the 28th president of the United States of America. Good old Woodrow Wilson, the guy who was basically led us into World War I, and he was president from like, was it 1913 to 1921. That's a long time. He had 8 years, 2 terms. Well done, Woodrow Wilson. All right, so some of his portraits didn't portray him wearing glasses. Some of them did. As if you guys care, but you know what? We're gonna do this. So, because I had a good time figuring this out. All right, next one. All right, you know what? Woodrow Wilson, 28th. Well, guess what? The 29th president, Warren G. Harding, also saw, he was like, oh, this guy looks great in glasses. I'm going to wear my glasses. That's right. Warren G. Harding, president number 2, glasses wear in the presidential portraits. Let's see, Warren G. I don't really have a lot of information about Warren G. Harding, other than the fact that he was president during the famed Teapot Dome scandal, which was a bribery scandal involving the administration of Warren G. Harding. And at one point was known as the greatest and most sensational scandal in the history of American politics, because there was a senator or somebody in the cabinet, in Warren G. Harding's cabinet, who accepted bribes from oil companies. And it was the only time that someone in the administration went to prison. It was a big deal. So there you go. Warren G. Harding. And then we have to wait until the 32nd president. Oh, no, I missed one. Obviously, Theodore Roosevelt. Theodore Roosevelt, the 25th president. All right, that's the first time. I'm so sorry, Teddy. How can I forget Teddy? Because he's the only glasses, is the only time that glasses, as far as I know, have been cut into a mountain. Mount Rushmore, Teddy Roosevelt, love it. That's the only reason I don't know much about Teddy Roosevelt, turn of the century, 1900s president, and he wears glasses, and he loved his glasses so much that he wanted them cut into the mountain for Mount Rushmore. Although I don't know when that was done, so maybe he was long gone by then. Let's say so. Roosevelt. Then Woodrow Wilson, Warren G. Harding. Then we got Harry S. Truman. Harry S. Truman, World War II, dropped the bombs. And then we have the last one, Dwight D. Eisenhower. They're all like right there, 25 to 33. That was like the golden age of presidential glasses wearing. Dwight D. Eisenhower, last one. Now, he is not really wearing them. They're like in the portrait. They're like on a book or something. So that's like partial credit. But I still count it because it's like a good depiction of glasses. The glasses look great. He's fine too, but the glasses in the portrait look great. So there you have it. 5 presidents in some proximity to glasses in their presidential portraits. I appreciate all of them. Thank you for that. And let's take a break. All right, for those of you who are still listening, after I went through how many presidents were wearing glasses in their presidential portraits, Jesus Christ, I can't believe I have sponsors for this. Thank you, people that support me. Jesus. Okay. Well, anyway, I had a wonderful time in Washington, D.C. Great show. We got another one coming up. West Nyack, New York, a place I've never been to, apparently. The improv theater that we're performing at is in a mall. Little blast from the past. The Palisades Mall. It's like a famous mall. Still going. I'm excited to walk the mall. That's what I want to do. I want to walk around. I want to see what malls look like in 2024. It has been a minute since I've been inside a mall. All right, I've got another topic before we get to eyeballs specifically. All right. Big news in healthcare. Big news in residency training programs. The AAMC, the American Academy of Medical Colleges, I think that is, the AAMC, is having a rough time. They're having a rough time. So the AMC, they're not great. All right, people have problems with the AAMC. They are the ones that run ERAS. So this is the Electronic Residency Application Service. So for years and years, almost every specialty in medicine outside of a couple, namely ophthalmology, we have our own little application match system. I think urology also does their own thing. Could be wrong about that one. But anyway, all the specialties for a long, long time, save for a couple, used the AAMC's ERAS service. And so basically what you do if you're a med student applying to residency, you put in your application. It's a whole thing. You got to do all your CV and your scores, and you have to upload your letters, and you talk about your hobbies, hiking. That's actually automatically populated. Yeah, your love of outdoors is already put in there. We know that you love the outdoors. Research experiences, all those things. It goes into this ERAS, electronic application, and then it gets sent out to all the programs that you wanted to send it to. And it's a tiered payment, a fee structure. So like your first 10 programs you want to apply to are like X amount. I don't know. I don't know the updated, what it's been. I don't even remember what it was when I applied. But it's like a certain amount of money for the first 10. And then the next 10 programs, if you apply like 20 programs, well, the next 10 of them are more money. And then if you apply to 10 more above that, it's more money. Like the fee per program gets higher the more programs. It's like punishing you for wanting to apply to more programs. And this is obviously, this adds up. Now we're talking like thousands of dollars that med students are forking over, thousands of dollars they don't have to apply to residency. And so for years and years, there's like med students, everybody, residents, just people in medicine have been bemoaning the high cost of applying to residency, which is something you have to do. And so people are taking out loans. I took out a loan to apply for residency. It sucks. And the AAMC, as a result, the people that run this program, of course, like, people just don't like them. And the biggest problem is because the biggest reason is because the ERAS system, that is like their cash cow. They make millions and millions of dollars off of this application service. And sometimes it doesn't like work well. And it's like predatory in terms of just the sheer amount of money that they're getting from doing this. And then for like, how much does it cost to run it? Like that, this is all this concern about like, this is like kind of a predatory practice. Well, anyway, recent news is that some residencies or some specialties are starting to get fed up with it, and they're leaving ERAS. That's right. They're leaving the electronic residency application service. They are pulling out away from the cash cow of the AAMC, and the AAMC can't be too happy about this. So recently, now it's emergency medicine's turn. So the OBGYN residencies, they have pulled out and they started their own service. This like residency CAS thing. And it's apparently gone pretty well, like fairly smoothly. They just do their own thing, because why not? Like, you don't have to do the same thing that, like, OBGYN doesn't have to do the same thing internal medicine does and pediatric does, because they're their own programs. They're their own specialty. They can do whatever. They can build their own, which is basically what OBGYN did. They just developed their own application system, because why not? And so emergency medicine was like, oh, I like this. This seems better. This seems more functional. This seems like we just do our own thing. And so they're actually maybe going to to use the same thing that OBGYN is doing. But most importantly, they're leaving the AAMC. You know what? I'm all for it. Hey, let's distribute the power a little bit more. Let's not like give this one organization all this money that they use to pay all their executives a ton, all on the backs of med student loans. That's what's funding this organization. Med school loans. Money that med students don't have, that they have to pay back. It's a lot of it's going to the AAMC. So yeah, I'm all for it. I love it. Absolutely. You know how I do. guys, I love when you take like something that's basically been monopolized in healthcare and you work to destroy it. Big fan. Big fan. Don't like the monopolies in healthcare, and there's a lot of them, from PBMs to insurance companies, which are basically the same thing now, to the AAMC, to Elsevier, to Springer, academic publishers. No, don't like the way they do business. Let's tear them down. Okay, so that's the recent news in healthcare. Let's see how we're doing on time here. So, yeah, let's keep going. All right, I got plenty of time to talk about our eyeball topic. So I went through the YouTube comments of our the most recent Knock Knock Eye episode that was posted. It was I talked about worst case eye problems, the eye problems that I would not want to have, including acanthamoeba keratitis, a devastating, potentially devastating, horrifying eye infection of the cornea, an infection of the cornea I would never want to have. It's like my least, if I have a favorite, it's my least favorite eye infection. I would not want to have it. I don't want to treat it. I hate having to treat it. I hate it when people get it because it's a blinding condition, and it's, most importantly, avoidable. So anyway, I did an episode about acanthamoeba keratitis, and I was going through the comments. Thank you all. Please comment at Glaucomfleckens. All right, all of these YouTube or Knock Knock Eye episodes are up on YouTube. And so I had some great comments, but I want to talk about one in particular that's going to set up our topic. And that was, at Morningstar4040, who was, at first he was talking about the episode where I did state driving standards, which is very interesting for me and for the audience. You guys love hearing about that. But also said, this person also said, our infant's congenital glaucoma was misdiagnosed as a blocked tear duct for 11 months, leading to permanent compromised vision in one eye. While congenital glaucoma is rather rare, can you briefly discuss the warning signs for physicians and caregivers who listen to your channel? I love that suggestion. That is such a great idea. So real quick, just to address this particular concern, congenital glaucoma is something, it is rare, and it can be misdiagnosed because it's drilled into our heads from the beginning of residency that there are a couple of very important, very significant signs that a newborn might have congenital glaucoma. We're talking like 0 to 3 months old. And those things are tearing and blepharospasm, light photosensitivity. Basically, like the infant doesn't seem to want to be around light. Bright lights really bother. That is because often there's a little bit of cloudiness to the cornea whenever you have congenital glaucoma, because you have a high eye pressure in a little baby, and that can push fluid into the cornea and cause the cornea to be cloudy. And if you shine light on a cloudy cornea, it basically diffracts the light and it kind of glares out the vision and can be really uncomfortable for people. That's why people who have cataracts hate driving at night, because the bright lights from the headlights, the cornea hits the cataract, it scatters, and it just causes all this glare. Well, kind of a similar thing with congenital glaucoma. And a little baby who has a cloudy cornea from high eye pressure is not going to like bright lights because of the cloudiness in there. And then the tearing is actually typically a sign that just the eye system itself, the way everything works, including the tear drainage system, is immature. And so little babies who have tearing, it could be a blocked tear drainage system. That could be it, but it could just be a very immature system. And if the tear drainage system is immature, then the aqueous drainage system inside the eye may also be immature. Because normally we're born, we have a functioning trabecular meshwork that drains, allows the fluid that our eye makes, the aqueous fluid, it makes it, the eye also drains it. And when you're born normal in a normal eye, that drainage system is intact. But in an immature eye that just didn't develop normally, you can have certain things like the tear drainage system and the trabecular meshwork that just hasn't developed correctly. And that can lead to tearing, but it can also be a sign of something more serious, like a blinding condition like congenital glaucoma. So that's what that is. If you take away one thing from this episode, especially if you're a physician who sees kids, who sees babies, neonatologist, pediatrician, family medicine, general practitioner, whatever you are, a little infant with tearing, they got to have an eye exam. They got to have an eye exam. Okay? Very important. Okay. But that leads to a great topic that we're going to do for the rest of this episode, which is just very simply child eye problems you shouldn't ignore. All right, let's take a break. I'll be right back. Okay, here we go. So this is, again, basically symptoms, things that you see, not just symptoms, but also signs, symptoms and signs of that little kids might have that you as a parent or you as a healthcare provider, physician, nurse, whatever it is you do, if you take care of kids, you don't want to ignore these things that might come into your clinic or your urgent care or your emergency medicine or emergency department. These are things that you want to pay attention to, okay? So child eye problems that you should never ignore. So we're going to start with blinking, like aggressive blinking or rubbing of the eyes. So the most often reason why like kids will frequently rub their eyes is allergies. Very common. You know, a sign of allergies would be the eyes look a little red. There's a little redness around the eye. They're having sneezing, runny nose, other signs of allergy. They have eczema. There's other signs that this is a child that just tends to have allergies. All right. So that's the easiest explanation for why a kid might be rubbing their eyes. Sometimes they can get a foreign body in their eye that causes them to rub a lot. But sometimes repeated blinking, like aggressive, hard blinking, I don't know the best, just forceful, so we'll call it forceful blinking. Are you a hard blinker? Call your ophthalmologist. No, forceful blinking and rubbing of the eyes can indicate a refractive error. So that can sometimes be a sign that a child is nearsighted. Maybe they're very farsighted, but nearsighted. And they should have an eye exam because you can save a little kid's vision, especially under the age of 8 or 9, if you get them into glasses at an appropriate time. All right, so eye rubbing, repeated blinking, that could be nearsightedness. Just a good idea, get an eye exam, all right? Pediatric ophthalmologist or just a general ophthalmologist or an optometrist. All those people can check a glasses prescription, all right? So just go in, get an appointment, see an eye doctor for that child. All right, so blinking or rubbing, that's the first one. Another one, new spots on the eyes, on the white part of the eye. That's one. I just had a patient not too long ago who I want to say 10, 11, 12-year-old, somewhere around there. They noticed a new spot on the white part of the eye, just a little nevus, like a little brown spot. And that can be very rarely that there can be a problem with that, but they did the right thing. They don't know, so they came in to see me. I think it looks like a benign spot. Obviously, any kind of pigmented spot on the white part of the eye, the first thing that we think about is, could this be a malignant melanoma type lesion? And so we look at things like, is there a lot of vascularity to it? Is there a lot of different colors? Like, is it a homogeneous looking color change, or is there darker colors in the spot and lighter colors? Is the border of it irregular? What about the size of it? How quickly did it come on? All these things we look at when someone comes in to have a spot evaluated on the white part of the eye. Especially Caucasian patients, they typically don't have a lot of spots on their eyes. There is something called racial melanosis. And so black patients are more likely to have pigmented spots. Not just black, but any darkly pigmented patients are more likely to have pigmented spots on the white part of the eye. And that's totally normal. It's totally normal. That's racial melanosis. But for a white patient, it's less common, and it's a little bit more worrisome. Not to say it's going to be a melanoma if you have a brown spot on it, but it's definitely something you need to get checked out. I have patients that come in once a year. We check those spots on their white part of their eye and make sure it doesn't look like melanoma or that it hasn't changed in appearance. We'll take pictures and compare that year over year. So if you have a kid, you see a new spot, it could just be, sometimes you get spots like that that come up, little brown spots that come up with puberty, changes in hormones. All right. You can get new moles on your body. Well, you can get a little pigmented spots on the eye. But just like you'd go see a dermatologist if you have a weird new mole, go see an ophthalmologist if you got a new weird thing on the eyeball. All right. So that's the second thing. Third thing, difference in pupil size. This is very important. So if you now there's this thing, so what we're talking about is anisocoria, difference in pupil size. One pupil looks larger than the other, and that can be in any lighting conditions, dim light, bright light. Most people notice it in bright light because how often can you really see pupils very well in dim light? That's a pretty frequent consult that we'll get as ophthalmologists is, someone told me that my pupils were different sizes, that I should get that checked out. Yeah, it's a good idea. The vast majority of the time, it's what we call physiologic anisocoria. So about 20% of the population has a small difference in pupil size between the two eyes. And it's never more than about maybe at most 2 millimeters of difference. And we can measure it. Like we have little measuring things that we can hold up to the eyes. And I do that frequently. And so it's always something you want to be concerned about, especially in kids, because there are certain things. There's congenital Horner syndrome. There's obviously tumors that can develop. These are all pretty rare things, but you don't want to miss them, right? That can compromise the sympathetic nerves and give you one pupil that's much smaller than the other pupil because there's no sympathetic innervation. Just all parasympathetics, it's going to cause you to have a small pupil, what we call miosis, as opposed to mydriasis, which is a larger pupil than average. But if you pay attention, if you're examining a kid, or you're just a parent, you're going to look at your kid's eyes all the time, right? And you notice a clear difference in pupil size, you got to get them in to see somebody. All right. You can start with your pediatrician, but then often you'll end up going to see an eye doctor. But sometimes you need that to get the referral to see someone like me. All right. So difference in pupil size. That's big. Another one is what I kind of talked about already, which is like crusting, goopiness, tearing, which again, that in an infant, that could be congenital glaucoma. That's like one neuron arc. We're like, could this be congenital glaucoma? Because that's the one thing you don't want to miss in that age group. But it could be also a nasolacrimal duct obstruction, what we call an NLDO. And that could require surgery to fix. And just but it could also be just something as simple as allergies or a pink eye, viral conjunctivitis, bacterial conjunctivitis. But it's always, if you have any goop or crustiness or tearing of the eyes, not a bad idea to at least, get an appointment to see like urgent care or your pediatrician, give them a call. And then if it's something that looks maybe a little bit more severe, maybe like if it's like in a 2-month-old or 3-month-old, chances are you'll probably end up going to see a pediatric ophthalmologist because that's a little bit unusual to have a lot of tearing in a little baby like that. So anyway, keep that in mind. Most of the time with like a goopy eye, it's just going to be a viral conjunctivitis. And that's school age kids. That's most likely what it's going to be, right? And then sometimes you need antibiotics, sometimes you don't. But that's something that's, I think it's worth getting an appointment for, not necessarily an eye appointment and like an eye doctor, but in some cases that is a necessary escalation. But a goopy eye, honestly, like there's a lot of different types of physicians, a lot of different types of healthcare professionals that can handle that kind of thing. Misaligned eyes. All right, so if one eye is turned inward, outward, upward, downward, that is a sign of strabismus, which occurs in about 2 to 5% of children in America. And this can be a big problem. It can lead to permanent vision loss in the form of amblyopia, which is where the brain just doesn't learn normal vision in that eye. So you want to try to avoid that. And so you want to take that seriously if you start seeing an eye that either all the time or it comes and goes. Because, sometimes, and usually we're talking, it's like within the first few months of life, like 3 to 4 months, it's actually pretty common for one eye to like temporarily move in and out. The vision system is trying to develop. But if it persists longer than a few months, or if it just becomes permanent, obviously, if you have like one eye that is permanently stuck in toward the nose or out or up or down, like that is unusual. It should never be constant. The first few months of life, you can have like, mainly like the first 2 months, you can have the eyes can be a little googly. As long as it's intermittent though, if it's ever constant, you got to get that checked out. Okay, so that's very important. But then after a few months, like it settles in. So if you have like a 2-year-old, and one eye is like intermittently going in, then that kid might just need glasses, might need patching, but there's only one way to find out, and that's to go see an eye doctor. All right, that's a very reasonable thing to get evaluated for. And I guess the last one would be sometimes like head tilting. That's the last thing I was able to come up with. Like head tilting or covering an eye because like clearly favoring one eye over the other. That could also indicate amblyopia. So you can have amblyopia without strabismus. Sometimes kids will maybe they have one eye that has a lot of astigmatism to it, or they have one eye that's nearsighted or really farsighted. They'll just ignore that eye. And sometimes to ignore it, they'll just cover it and they'll just look with their good eye. Or they'll tilt because, with astigmatism, kids will often turn their face to see to the side to see a little bit more clearly with astigmatism. So it can be a sign of refractive error if you see head tilting, head turning, covering one eye. If you see that consistently, probably a good idea just to get a checkup. All right, get evaluated, get an eye exam for that kid. Again, ophthalmologists, optometrists, even school screening exams are decent. They're not great. So if you're concerned as a parent, as a healthcare professional, like don't hesitate. there's lots of eye doctors out there, optometrists and ophthalmologists, who can do a very good eye exam, check refractive error. So that's what I got. Those are the things. So I'll just run through those again real quick. If I come up with more, I'll add them in a later episode. But blinking, eye rubbing, spots on the white part of the eye, unequal pupils, crustiness, goopiness, tearing of the eyes, misaligned eyes, strabismus, and then like head tilting, head turning, covering an eye, that kind of thing. All right? Try not to ignore those. Like, take them seriously. You can watch a little bit, see how it goes, like with like eye crusting and gooping, but do not hesitate to get an appointment, see a doctor. So thank you all for listening. That's our episode of Knock Knock Eye for today. Thank you to my host. My host. Thank you to me. Thank you to me, your host. Thanks to my producers, Rob Goldman, Aaron Corney, Shanti Brook, editor and engineer Jason Portizo. Music, by the way, I met Jason for the first time at our DC show. Wonderful guy. It's amazing. You can work with people in this day and age for years, and you never actually meet them. But I finally got to meet one of our producers, our editor. And our music is by Omer Binsby. So thank you all for listening. Again, email me if you want to get a hold of me. If I screwed anything up, that was my phone that was just going off. If you have any suggestions, topics you want to hear, anything I said that was wrong that you want to correct me on, I'm all ears, definitely, and all eyes. And so knock knock hi at human-content.com. Again, I also read the YouTube comments when these are posted. All right, so go to our YouTube channel at glaucomfleckens. Leave a comment. Tell me what you think. I'd love to hear you guys' feedback. It's good. It helps me. It helps this show. All right, so that's it for today. We'll see you next time. Knock knock. I is a human content production.
Knock knock. Goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts, or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below, let us know what you think.